So now we're going to talk about regenerative medicine of the shoulder. Typically the shoulder joint is a complicated joint because it's the most flexible joint in our body. It's a joint that we as human beings and only a couple other creatures, you probably know the great apes, can move in multiple directions. But the more flexible a joint is, the more unstable the joint is. So the shoulder is, as one of the doctors I work with said, it's kind of held together by spit and baling wire. It's a joint that easily gets hurt, is easily dislocated. So it's a joint you have to pay special attention to. So there are people out there who will do regenerative medicine. They'll just inject something into the joint and they'll say you're done. And because you have shoulder arthritis, and they'll look at an x-ray and say, see, there's your arthritis. Well, as you might know, after a certain age, we all get arthritis. And it may not bother you, you may not have any symptoms. You might be in your 40s or 50s and your knees might feel great, but I guarantee you, if you own an x-ray, I've yet to meet the person whose 50-year-old knees look like their 20-year-old knees. So the fact you have arthritis in the joint does not necessarily mean that's the big source of your problem. So part of doing a good procedure is recognizing what's actually hurting you. And that's why we do an exam and some specialized tests. You know, your doctor may have you take your arm and he may rotate your arm and have you see if it pinches. Well, usually that means that you got a rotator cuff problem. It's called an impingement, where your arm is riding up and the shoulder's rubbing against the arm. And so in that particular case, you may want to stabilize a couple things like the rotator cuff muscles. So once you're put in the right position and you're numbed up or anesthetized and cleaned off, a needle will be taken and you're going to predominantly focus on what we call the fibroosseous junctions. And that's just a fancy way of saying where soft tissue, connective tissue, attaches to bone. Whether it's a ligament that's holding the bone to the bone or a tendon that's attaching the muscle to the bone. So a shoulder example might be this joint right here called the AC joint, which kind of, when you get a shoulder sprain, that'll get affected, or a shoulder dislocation, or separated shoulder. You may want to get your rotator cuff muscle that lifts your arm up here. You'll want to get them in the back. And there's a few ways you can get in the shoulder. One way is to go directly here, and another way is to use an ultrasound machine and guide your needle directly through the back of the shoulder, because that's how you get into the joint itself. And you can help rebuild what's called the glenoid labrum, which is a cartilage ring that kind of surrounds the shoulder. If you're a wrestler or a football player, and you might have heard I got a labral tear, that's what they're talking about. Hockey players get them in their hips a lot. That cartilage ring is very important for stability. So the idea of regenerative medicine is don't look at the joint just by x-ray. Think like an engineer or an architect would. You know, what's holding that wall up? You know, what are the load-bearing joints? That's really what you're thinking about with regenerative medicine. You want to attach to things that are stabilizing you, and you want to focus on the ones that hurt the person the most, because those need the most attention.